We're excited to have caught Dr. Shar Hashemi as we were finishing up the video, so we figured let's take the opportunity. I talked a lot about kind of what went into the design, the permitting, the construction, of course, the recent Department of Health final inspections. Now, Dr. Shar, I would love for you to kind of get into exactly how the design first for these 2 operating rooms and 1 procedure room came to be, exactly what you just mentioned, what you were working on with for the variants for these peri-op bays that Wilmar just went in depth on, kind of how we're modifying design, and basically anything else about what you're doing to get ready for your grand opening.
Yeah, that's great. Yeah, thank you very much. So I think the partnership that we have with Liberty has just been really natural and beautiful. With any project as sophisticated as this in the nation's capital, you're going to run into challenges. And if you don't run into challenges, it's like my mentor in New York City would say that if you don't have a complication or some kind of legal interface, then you're not performing surgery. So meaning that you're going to have complications. It's really not the complication or the challenge. It's how you can overcome that, how you can strategize, and how you can use that as an opportunity to continue to improve. Aside from becoming code compliant, the ambulatory surgery center is going to be the birthplace of creativity and innovation for surgeons in the fields of orthopedics, neurosurgery, reconstructive surgery, and other subspecialties. It's going to be an environment where we can collaborate with patient care, we can identify what patients want, what they need, and we can render that to them. In the current climate of large health systems, sometimes these basic needs are dismissed, forgotten, or not even identified. But for us, each detail is extremely important, and that's how we're able to create these environments where patients actually feel valued, staff love to come to work, and surgeons are able to perform their art in a collaborative or individually, in caring for patients.
Well, that's safe to say a lot of thought went into this, like years before you even called me.
Absolutely.
To first discuss the plan for your new ASC facility, state of the art, and your surgery especially, and like upper nerve damage. It's definitely, there's a need for it, really, in any community, but here in the heart of the nation's capital, heart of the world, essentially, we are basically doing what I think is going to be repeated by a lot of other states, some jurisdictions, because there really isn't enough specialized care, especially for what you do. And it all kind of works in together. You have your needs as the head surgeon that you express to me as a design builder. We collaborate with, of course, very talented people like Wilmar, who's done surgical offices before, but that's just only the tip of the iceberg.
Sure.
I mean, you have partners, you have investors, you have other providers, surgeons, all working. And of course, we're standing at the nurse station here. These are gonna be some very, very talented, important medical staff trained to deal with the kind of emergencies that you would expect for a acute care facility like this, which has, I guess we're trying to figure out how many peri-op bays we're gonna end up with exactly. But what is, I guess, going on with that? And can you talk a little bit about when trying to figure out how much square footage you might need for an ASC? Does it start with how many ORs you're going to build, and then you get to the peri-op or PACU bays, or kind of like what is the source of it? Because right before this, just for some context, Wilmar kind of went into the clearances needed.
Sure.
We talked about the square footage required for the ORs.
Sure.
So of course, those are some constraints, and you can only fit so much in an existing building. We are in a historic building in 3 Washington Circle Northwest. So it's kind of like your background in residency in New York City. You're kind of used to the tight spaces, but I guess if we can talk a little bit about how we got to this floor plan before we started construction.
That's a good point. So for our process here, we had initially our certificate of need in Washington, D.C. Our certificate of need is required to open and maintain an ambulatory surgery center. So we were fortunate enough to be the only privately held ambulatory surgery center in Washington, D.C. Our original location was at 1145 19th Street, and that was historically MedStar's first ambulatory surgery center in the DMV region. So when we were able to purchase another ambulatory surgery center and relocate it to 1145 19th Street, at that time we had 3 ORs. And our goal was to transfer that here And through a proper process with our CON legal team, we were successfully able to have CON approval to open here 2 rooms, 1 procedure room. On the most important side, Liberty has designed the 3rd room to meet all of the air handling, the anesthesia, spacing for an operating room. And again, that's really important because you start with how many numbers of doctors that we start with, and also the number of hours each operating room can support. And we look forward to not just the financial forecasting, but also the clinical support. With respect to the PACU and the pre-op, some centers have the pre-op in a one designated area. With the space and the unique spacing that we have here, we thought that it would be wise for us to synergize pre and post-op in one setting. And if we had 4 to 5, then depending on the surgeons that have shorter operating time, then the throughput of each patient being able to be in the pre-op or post-op would support more beds. Other surgeons that have longer surgeries, there's no need to have numerous beds because it would occupy most of the day, so there will be 1 to 2 surgeries. So you try your best to design something to satisfy each of the different surgeons and also the growth of the facility in order to serve the community, serve the patients, and also to stay fiscally compliant with our lending partners.
Well, that is great information. I think it really touches on the point. You can't emphasize enough the amount of pre-planning you need. And the due diligence phase is far before you purchase a suite like this, or even if it's a lease or you're expanding into the space next door because you've already have an established practice. It starts exactly what you said, where you are expanding on the care that you already provide in your existing practices. You then get a space like this. You talk to a design builder like me. We eventually get in front of DOB or whoever your jurisdiction is for your local municipality that's going to eventually have a Department of Health involved. And there's a lot of planning. Not one single entity is going to have all the answers. You know what you need for your patients now, but also for the next 10 years, because ASCs are only going to be a more commonly kind of relied upon source for that specialized treatment, not just in DC, but you go to rural areas, it's going to be the same exact situation where not everyone not only can, but would want to go to a big medical institution to get that, not just specialized care, but also, recurring needs as well. It's definitely, when you have a state-of-the-art facility like this, not every area is as fortunate to have these kind of resources, but you need to put them wherever you can. And I guess I touched a little bit upon it with the future as well. Could you kind of explain, when we're all done here, I get that magical, DOH final inspection approval for you. What other work do you have to do here to get this place ready to see patients, to do surgery? And what plans could you have already been thinking of for the future when you were designing this space now that we're finishing building, that is going to work for the flexibility of your needs in a decade from now?
That's a good point. So I think on the first question, in terms of, we have already been communicating with the other divisions of DC Health, which include the radiation division, and they're the ones that come and check our dosimetry badges and radiation safety protocols and policies and procedures. And separately, the pharmacy division. We have a pharmacy consultant, and we have policies and procedures and safeguards that support that line, in addition to new medications coming in. So we're going to be having them come on board prior to DC Health, because once DC Health comes, our expectation is to be able to turnkey and support surgeries. Your second question was, how can I forecast before coming here any of those bottlenecks? I think at any time you need a team like our design build team, in addition to our experience. This is the 4th iteration of an ambulatory surgery center that I've been involved in with significant amount of time, effort. So you need a team that is able to both forecast and also get you through each of the hurdles. So that development team, if you will, is imperative, that they don't just help you design which surgeons are going to be doing what types of surgeries, but from the detail of who the legal team is, who the design team is, who your compliance officers are, who the code experts are. And then also making sure that, as you grow, there's a lot of interface that you're going to have with commercial, federal payers that you need to ensure that you're compliant from the beginning with those recommendations and what future accreditation is going to be needed. So I'm grateful that we have such a great global team, and those team members you're not seeing necessarily directly, but these are the individuals that we communicate with on a daily basis. So moving forward, if we were to design another ASC for another team, we would get to know our client and spend a significant amount of time in understanding what their needs are, what their catchment area is, who they're serving, what surgeons are involved, what types of surgeries are going to be performed, who the staffing is, and all the details from the clinical, operation, business, infrastructure, regulatory, to be able to really create a robust plan, also that is flexible, that has contingency built within it.
Oh, that's great. I think this is invaluable info for not just anyone who's in my position and is working as even not just on the contractor side, the design builder side, or even a third party. If you are in anywhere in the sphere of private practices that are surgical, outpatient, ambulatory care at that level, I think this is just proof that not only there's these things that you have to think about way in advance, but the amount of people behind the scenes. I would love to say that Liberty Constructions and our amazing superintendent and project management team and our subcontractors are what made this come to life. But the reality is that, we brought in Allied Medgas as a Medgas consultant who also provided a lot of the equipment. You brought in Steris and many other companies that, aren't just dropping off equipment and saying, see ya. They are working with us before we even finish design, before we've submitted for permits. So before we're even building this place, everyone already knows the exact ceiling heights that we're dealing with, spatial constraints, the surgeon's preference as far as orientation when working, on a patient, the configuration of the room, the power supply that a building like this, historic building in DC, which everything is limited. In DC has the best of any kind of resources, but also has the biggest limitation. And you have to achieve that balance by doing exactly what Dr. Hashemi touched on, which is have the people in the background, that you don't see every day, but that are necessary, required, if you're ever even gonna contemplate as big of a feat as what you said is gonna be the only privately, owned ambulatory surgical center in Washington, D.C.
Yeah, I definitely agree. And honestly, it's a privilege to be able to be sitting here with, our construction colleagues to just share with us, our experience, and hopefully we could help other organizations around the country that if they have this dream and vision, how we can make that dream come to fruition and reality. Thank you very much.
Thank you. I'm excited to, next video is going to be when operating rooms are done and we're going to be doing a final walkthrough, so tune in for that. Thank you.
Thank you. Thank you very much.